Code stroke has been called. We're going to walk through the steps of administering and preparing tPA.
Okay, so Ashley has correctly identified her patient using 2 patient identifiers, and she's confirmed the patient's actual weight in kilograms. Once she's done that, she's going to verify the alteplase order in Cerner. When reviewing the order, she is making note that the alteplase dose is 0.9 milligrams per kilogram and does not exceed 90 milligrams of the total dose, and that 10% of that total dose is given as the bolus. She has verified that her patient weighs 75 kilograms, and when looking at the actual weight, she's going to confirm the dose in Cerner with a second nurse or practitioner.
Okay, so we have kilos. At 6.8 milligram bolus, which is 6.8 ml, and then we're going to do a 61.2 milligram.
Weighs 32.
Weighs 32.
Okay.
Once this confirmation has taken place between both nurses, Ashley is going to retrieve the alteplase labels from the pharmacy printer. And then she is going to retrieve the alteplase medication from Pyxis. Note when the Pyxis screen pops up, there will be an inventory count. You will see the count show up in your infusion dosage in milligrams. Ashley's pulling the alteplase box from Pyxis, and she will also open up the 25 ml sleeve inside the Pyxis as well, and take that with her, which will be used for the flush after the infusion has been administered. So now Ashley's ready to mix the tPA, so she's going to remove the vials from the box, and she'll find a connector device. She'll find a 100 ml vial of sterile water and the alteplase powder, which is also going to equal 100 milligrams. She's going to start by disinfecting both vials with an alcohol swab for at least 10 seconds. Now she's going to take the transfer device and insert one end into the vial that contains the sterile water. Next, she's going to hold the alteplase vial upside down and position it so that the center of the stopper is directly over the transfer device in the sterile water vial. Push the alteplase vial down onto the transfer device, ensuring that the piercing pin is inserted through the center of the vial stopper. Once this is done, invert the vials, allowing the sterile water to flow into the alteplase device. Once the transferring of the sterile water has taken place, Ashley will remove the transfer device and the sterile water vial. It's important to note that you do not shake the medication. Shaking of the medication can cause the mixture to foam. If foaming occurs, allow the vial to stand for several minutes for the foam to dissipate. Once all of the sterile water has been transferred into the Alteplase vial, Ashley will gently swirl to mix. Now that the Alteplase has been reconstituted, Ashley is going to withdraw the excess volume from the reconstituted vial. After pulling out the excess dose, Ashley will label her discard syringes . The label will say discard, and she will place these syringes in the tPA replacement bin. Based off of the Alteplase reference card, Ashley knows to discard a quantity of 36.2 mLs. So this discarded amount is placed in the tPA replacement bin, and it will stay there just in case there's a change in the patient's clinical condition. Now Ashley's going to withdraw the bolus. The bolus is 10% of the total dose. And she has confirmed this with the order. Once she has drawn this up, she will label both the syringe, which is her bolus, with the label that was printed from the pharmacy printer. She will also label the infusion vial with the infusion label that printed from the pharmacy printer. Ashley is also going to inspect the medication for particulates, discoloration, and any loss of integrity. She knows not to use the medication if it is cloudy or precipitated, unless such is indicated by the manufacturer as being safe. Otherwise, this may lead to harmful reactions. Ashley also makes note of the patient's blood pressure prior to administration of tPA. She knows that the patient's blood pressure must be less than 185/110 prior to administration and must be maintained with a systolic blood pressure of less than 180, diastolic 105 for at least 24 hours after administration of tPA. She also notes that tPA cannot be administered with any other IV medication.